Thursday is our first group of scenarios, our first couple groups. Mr. Richard will let you know who's going first with our scenario.
So firefighters, Greg, that's your group?
What?
You guys are firefighters?
Firefighters. Sure.
Alright.
Kanye was Vandenberg, that was your group?
Yeah. Was
We're
that
going
you?
last though that
The
day.
burglars were the third group?
Yeah.
Can we go last on that day, because Keely has a conflict?
That's fine.
Okay.
And then lifesavers. Who are the lifesavers? There's you guys.
Oh, we got Hannah.
Hannah's group? Okay, so those four will present on Thursday. So you gotta be ready for that.
So today, we have Sarah Steen from Aspirus Hospital, which is going to introduce a program that we as a staff were introduced to, I think 3 years ago, maybe 4, called Stop the Bleed. Is that?
I'm glad.
Yeah. So I'll let her go through all the stuff. We're gonna send around a sheet that, if you could please,
Probably just his
just your name and,
And maybe it's just, we'll do walk the lesson drawing.
yeah.
I'll fill in all
Yeah.
that. No, nothing
They
else.
don't, okay, so just your name
Okay.
in that first column, so when we send that around, if you could fill that out, please. All right? So I will turn it over to Sarah.
Okay, hello. My background is nursing, so sometimes when I have more time, I love to just come and talk about nursing and what I do. So I'll try to blend a little bit of that in, but once we kind of get into the Stop the Bleed program, it's really kind of focused on stopping the bleed. So I did 10 years in the med-surg ICU, and I got a really good base of taking care of really critical patients, a lot of them traumas, you know, depending on whatever's in our community, but really good at like ventilators and drips and keeping people alive. And I held the hand of many dying people too that passed on that we couldn't save. So nursing, I love the career. I'm really happy I made this choice. It's flexible. So I could be in my role now, which is like a clinical, more clerical, not clerical, non-clinical, doing nursing stuff, but there's also the bedside too that I enjoyed. I did recognize at one point I was burnt out of bedside nursing, and that's come to light now. We talk about that a lot more because it's a real thing, and I worry immensely for our staff now that they're burnt out. But it's kind of like you kind of get so hard because you can't emotionally deal with all of those things that happen. And just the reality that I could die every single day got to me, and I just needed to kind of get away from that. So I go to trauma, which seems a little odd now that I say it out loud, but basically what I do now, I've been in this role for 10 years already too, and I make sure that we continue to be a level 2 trauma center. So I have a staff of like 7 employees, and we run a quality program. We look at the care given to people on Steen with EMS, all the way through discharge at our hospital. We look at the care given at other hospitals, and we look for opportunities to make it better. So I'm not at the bedside taking care of patients anymore, but I'm influencing it from a bigger level, and I'm reaching more people. So sometime if you want to talk more about nursing, we can do that too. But I think I'm going to get into the Stop the Bleed stuff. I'm kind of excited to talk about it. It's been a few years because of COVID, but it's one of my favorite things to teach and do. So you got a pamphlet or a little booklet. It's pretty simple. You know, I'm sure it's beyond written for a lower level. I'd say like 6th grade or something like that. So you guys are too smart for this, but at the end of it, if I forget, share this information with someone. Give this to someone else who could learn how to save someone's life. There's a certificate of completion that you can take or distribute, however you want to handle that, but you know, it just kind of says that you've been through this course and you're certified. and then the sign-in sheet. All right, so I actually hate that I have to talk about this because I don't want people to get hurt. I don't want things to happen, but it does. It does no matter what we do, as much as we try to prevent it. Bad things happen to people all the time. And so the reason this course came about is in December of 2012, and I was reflecting on that today, but that is almost 10 years ago, right? 10. That the Sandy Hook shooting happened. So that one was out east, and they had 20 first and second graders that were shot and died. More were injured. But out of that, a commission was established by the government, and they said, what could we have done differently? This is a horrible tragedy. How can we make a difference? How can we prevent the loss of life? Now, it's a multi-pronged approach trying to figure out why people mass shoot each other. I'm not going to get into the psychology aspect of that at all because I don't have it figured out at all. But what I can do is out of these, they actually looked at these autopsies of all these people, and they said, if we could have stopped the bleed, stopped hemorrhage for some of these, they could have possibly made it. So, all right, we need to stop the bleeding from someone that gets injured, but how long would it take for EMS to get here? I mean, even living right here in Wausau, it takes time. By the time they hike up those stairs and get to this classroom, where I live out in the country, it's at least 25 minutes before an ambulance can get to me. So I'm dead by then, if I'm bleeding out. So we have to teach each other. We have to teach our children that can handle it. I teach all my girls this. I have 4 kids ranging from 4th grade to a sophomore. And our families, our coworkers, wherever we are, we all need to know this information. And I'd love it to be built in the school curriculum someday, but that's why I'm here, to at least reach you guys. But a lot of people need to know how to do this. The things that they figured out is bystanders need to do the care. We need tools and equipment to do this life-saving care, the knowledge, and just making sure it's effective in what we do. So in 2017, this program was launched, and I remember being at a conference when they introduced it, and I was really excited to share this information with our community and each other that I see. I've done like civic groups like Girl Scouts, Boy Scouts. I've done little old ladies that come in to learn this stuff. I've done a lot of schools because I've written a couple of grants to get some of this equipment, and you guys will have a big kit somewhere when we find it as well that we have written a grant for. So that's a piece of it, is getting the equipment. Bless you. So far, we have taught over 1.5 million people. We have over 80,000 instructors. We've done almost 100,000 classes, and we've hit all 50 states with this program, and it's going worldwide as well. So why? Why do I have to be here doing this? Because of where I am in a school, I like to kind of tailor it to school stuff, because that's what I think of often. So far, this year, anyone got to guess how many school shootings there have been in 2021 so far, as of yesterday? Any guesses? In the U.S.?
4.
Nope.
Wait,
60.
how many more?
60? Less than
More.
60.
Less-
Good guess, though.
300.
Somewhere between 4 and 60.
It's less than 60. 32.
31! Very good. Very good.
So close.
And there's actually been 23 out of that 31 since August 1st. The most, there's this website and you can look, I think it's Everyday School, Every Safe School, something like that. And it shows where the mass shootings are. It has like a map of school shootings, how many people were injured, what the circumstances were. So I was looking up the most one of interest to me, which was in Michigan on November 30th of this year. Did you guys hear that on the news, that one? So it was in Oxford Township, which I don't know where that is. But a student went in with a semi-automatic rifle, came out of the bathroom, shot and killed 6 people and killed 4, shot and injured 6 students and teachers. They said there was over 100 911 phone calls from that incident. The students had learned, this is in a high school, I have goosebumps. The students had learned ALICE training, so there was actually a New York Times article looking at how the students implemented the ALICE training. Do you guys do ALICE here? Yeah. So there was a picture online that I saw of like a door and all these desks piled up and barricaded against the doors. The students found makeshift weapons, so scissors or things that they could throw at someone. And then they covered the windows to the rooms too. So that one, the reason, I don't know, I go between being interested in these things and not. Now that I'm doing this again, I'm kind of interested in it. But that was the first one where I saw that parents were charged with like an assistant into the shooting. And I don't think we've really seen that in our country yet. Now they're charged, they're not tried and things like that, but they had just bought the gun a couple days prior. You know, there was access for the student. There was other things too that I read where he was, the day before, had drawn pictures in the classroom and the teacher saw it and sent them to the office and said like, people will die, there'll be lots of blood, help me, kind of a thing. And so, I mean, there's lots of warning signs, and I'm getting into the weeds a little bit with that, but I just thought it was interesting. But one of the things that we're doing here, I'm going to get back to where I'm supposed to be talking. All these groups endorse this course, so you want to have, this is my endorsement group, you want to have the ED doctors and EMTs and tactical emergency medicine on board to endorse this training, to say it is good training. They took away a lot of my gory images, so I'm sorry. It apparently made people a little queasy, but I have some. I think one now. So 35% of pre-hospital deaths can be reduced or prevented if we can stop the bleeding. So that's a lot. And bleeding is the #1 reason trauma patients die in my hospital, for sure. So we really work hard as a hospital to stop that, even pre-hospital. So where can we use this training? We talked about school shootings, but yell out some other reasons and some of the pictures might help you. Where else might you come across someone in your life where they are hemorrhaging, bleeding?
At home.
Home, doing what? Cooking, sure. Slice off the old finger. The other day I was ripping out carpeting from my living room and I have this utility knife and I'm cutting it. And I'm like, ooh, I could just very easily hit the old thigh there with this crazy knife. Yep.
Car crash?
Yes. That's the #1 reason actually that I see tourniquets used is car crashes for sure. Good answer.
Anywhere where an incident can occur.
Anywhere where what?
An incident can occur.
Right, it can be anywhere. It could be in this room, from something, or, yep, anywhere. It could be the weather one, which has happened in Kentucky. Right, so that's tornadoes. There can definitely be things flying through the air, penetrating you, one of those crazy branches. Things falling on you, severing your arm off, or just even making big lacerations too. So weather definitely is another reason. I'll share a story of a guy, where's the clock? I gotta keep an eye on time. 1:50. 55. So one of my first stop and bleed classes I taught at the hospital, we just invited community members to come. And there was a guy working at a paper mill in town who came up and shared a story that one of these huge reams of paper fell on one of the coworkers and it got his arm and there was blood squirting. And they're like, here's some of those if they want. So then they were like, sit down, let us help you. And the guy is running around screaming, and there's blood squirting. And they could not get him to settle down. And eventually he went down because he lost so much blood. And then they could help him. But that was a, really scary story of that at work. Industrial events, certainly in our area, could happen in logging industry as well. But that guy went into shock. He was not able to think straight, didn't have enough blood flow to his head, and eventually you go down. The question they had asked me was, do we try to tackle him, knock him down, restrain him? And I said, no. They'll pass out eventually, and then you can render aid to them. But it's not worth you getting hurt to try to help someone in that way. Some specific areas in our school might be the shop or tech ed kind of area. Someone shared a story once on the football field of someone getting a big laceration and then assaults as well. So our goals for today is that we're going to identify what life-threatening bleeding is and then take steps to stop it, including pressure, packing, and tourniquets. And then we also have some models here at the end. We will do some practice. And everyone needs to try it. So, any questions so far? Any thoughts? All right. Post-lunch, I'm going to keep you guys awake. All right, so your safety is your first priority because we don't want 2 victims. We don't need more things going on. If you're injured, you can't help others. The old airplane mask, put your mask on before you can help someone else. Help someone when it's safe to do so. So if there's an active threat and a shooter situation going on, we're not gonna run out and try to help until it's safe to do so. All right, the ABCs in this case are going to be alert, bleeding, and compress. So alert, 911. Sorry. So like I said, I found that interesting that they shared that there was over 100 calls for that incident in Michigan. And honestly, when you're in a situation and you're in your room, for example, you have no idea what's going on out there. And 911 is an appropriate thing to call. However, it really ties up dispatch, doesn't it? Can you imagine being those people trying to answer all those phone calls there? And trying to write down who's where. So things that they'll want to know is, where are you? And hopefully you guys have a really good emergency plan here for at school. Because if you told me to try to get back to this room again, I don't think I could. It's amazing. So work with your local places, EMS and fire, to have rooms mapped out so that you can easily say where a situation is occurring. And I missed a slide. Oh, bleeding. I think they moved it. So with bleeding, I like on this page, in the booklet, page 8. So this is a little picture. They took a lot of this out of this, trying to simplify it, but I still like this. So blood that's spurting out of the wound. So that one guy with that's arterial bleeding, and you can bleed out and die within 3 to 5 minutes from that. So that's the kind of bleeding we're talking about. We're not talking about little paper cuts or abrasions that are superficial. We're talking real deep bleeding of a lot of blood. Blood that won't stop coming out of the wound. So blood that pools on the ground underneath, that's a lot of blood loss. And we see that quite often with some of our scene calls. Clothing that's soaked through with blood, bandages that are soaked through, and then loss of a limb, of an arm or leg. Sometimes, which do you think bleeds more? A fully amputated or partial, that's kind of just hanging there. Which one do you think is more? Why partial?
Because it's moving. That's the same one.
Okay, it's the right answer. Moving can dislodge stuff maybe. In my experience, once the blood vessel is like completely cut, it like retracts in on itself. So it kind of stops the bleeding itself. When it's kind of partially there and you've got that garden hose open, you know, then it just keeps going too. So just a thing to thought. And then bleeding in a victim who is now confused or unconscious. That's our guy who went into shock at the paper factory. So those are all things of life-threatening bleeding. There may be multiple places that someone's bleeding from, and boy, that would be kind of hard to decide which area do I pay attention to first. I would say the ones where it's squirting the most, or wherever the most amount of blood is. If you have more helpers though, you all can render aid or apply pressure, and the things we're going to talk about. And then just recognize too that clothing may hide bleeding. So be looking around, about. We don't need to strip people naked like we do in the ER to look for bleeding. But just kind of recognizing like, oh, honestly guys, even in the ER, we kind of get distracted when there's gross deformities of, there was a patient just last week where he was snowmobiling, a tractor was coming out of the driveway, he like swerved to miss the tractor and the sled rolled over on him. And his leg, you know, it's all fine until right here. That sucker snapped in half and a bone is sticking out this way and his foot is that way. Like making, I mean, that's crazy. Just, you would get totally distracted by that and then not pay attention to that arm that's bleeding as well. So, oh, I should share. Yeah, no, I won't. It's too fresh in the
Do it. Yes.
Well,
Yes.
saw the most horrific dog bite I've ever seen in my life. And I saw the pictures of her, and it was down, like chunks of skin, of tissue are gone. And there's bones sticking out, and the arm is cracked here and pointed this way. And it's the most horrific thing I've ever seen. And she had a ton of hemorrhage problems, and we struggled to stop the bleeding with her. And therefore we needed to transfuse just a ton of product and stuff to try to save her life. But my point is with that one, very easily distracted by that. To see that amount of blood for the first time, I mean, some people get queasy just from like a little paper cut or something. But honestly, I don't know how I'd react. If it's one thing in the ER in the hospital, it's another thing when it's my daughter or my mom where something happened and I see a crazy deformed body or a ton of blood on them. So my hope is that through this talk we're doing about bleeding, that you do something. You call 911, you get help, you apply pressure if you can. If you can't do that far, at least you did get them help. But honestly, guys, this is hard to do. And in that moment when your adrenaline is just pounding, I mean, some people freeze. But try not to freeze. Try to do something.
Sure, that's why we, like right now with our class, with this, you know, we're, the one day we have, like today we have speakers coming on our Tuesday, our Thursdays is we're introducing them to American Red Cross First Aid and CPR.
Sure, good.
And we really stress that the more we can practice this, the
Yeah.
more comfortable we are, because in the situation, when they have to really deal with it, there's gonna be some panic involved, and especially if it's a family member, someone, you know, elder, older, grandma, grandpa, whatever. So the more comfortable they are practicing it, and the more, you know, time they can spend on that, hopefully, you know, they take control of the situation.
Yeah, definitely. I love it. Happy you guys are in this class and getting exposed to some good things here. All right, there's some fly-ins. I gotta fiddle with them. Okay, so there's different places we bleed from. So extremities, that lady this week was an extremity injury. That guy with the leg, you know, we can We can put a tourniquet on, she did have one on, and some tourniquet examples are here, and I want you guys to practice with those before the end of the class. Those we can do tourniquets, as well as packing and pressure. Those junctional areas, armpits, don't put a tourniquet around someone's neck. They need blood flow. That's usually where people laugh. Come on. And then like, those areas are very difficult to get controlled bleeding and to put tourniquet on. So those areas we have to use some of our packing techniques. And then bleeding that is in the trunk or I even at the head, you need to get to a hospital as soon as possible. Because if you have a bleeding out spleen or a liver, there's not going to be anything we can do about it in the field. So our last thing we're going to learn is compress, pressure packing, and tourniquets. So just pressure alone will help. So if I have a cut here, we put above our heart, we apply pressure. You're going to learn more of that on Thursday with your first aid course. But you want to do direct pressure, and you want to find the exact spot where it is bleeding from. And sometimes that is hard to do. So you can lay over some gauze on a cut. Your shirt can save a life too. So whatever you have, and you do pressure, just like CPR and things like that with a big wound, you're going to apply pressure and hold it until someone comes to relieve you. So if the bleeding stops, good, but keep holding pressure. Because the second you let up, it could start again. Let's see if this works. So here's a little video of her doing a thing with my shirt. So she's just putting stuff right on top and using that CPR technique, handhold, to apply that pressure. This is exhausting to do, just like CPR is. It's really hard to use that much pressure, but that's what's needed. People ask me, so in this room if something happened, we can obviously use our shirts or napkins. I'm just kind of looking around. I suppose clothing is the best thing we have. People will ask me, what if it's like a dirty shirt or it's contaminated? It doesn't matter. If you're bleeding out and you have no other options, use it. So I don't care if you're in a barn and it's got cow poop on it or whatever. We'll deal with the infection and the cleaning out and the antibiotics later. But if they don't make it to our hospital, they ain't gonna make it. So use what you have around. Dish towels, just whatever you have at home to use. So now, with packing. So this wound that I have here is pretty large. It may have just looked like a cut, but later when you check it out, I can stick my finger in, that far, and it's, at least that wide. So underneath, it can be deceiving. So that's why we want to use packing with large wounds. I like this picture here because if you just put stuff on the top and you let that thing keep bleeding, it's not going to stop. It's a garden hose analogy is what I like to use. So if we, in contrast, pack something in there and put pressure against that wound, then we will stop the bleeding. So literally, you just keep filling that thing with whatever you have, a strip of a t-shirt, strip of a towel. You just keep shoving it in there until you can't get it in anymore. Put the rest on top and then do your pressure. Oh, but we have another video with that one.
So Sarah, well, a cut like that, obviously if it's by an artery or whatever, will bleed a lot, but, how are those gonna bleed a lot? Are those gonna be real noticeable to know, hey, because that could be on your piece of clothing or,
Right, yep.
So.
You kind of gotta look, once you see it starting to come through the clothing, in our kits too, we got a scissors. So cut that jean apart a little bit, cut the shirt apart a little bit to see. how deep it is or what's going on. Yeah,
Does it make a difference for people with different ages, like pressure, like how much pressure would you
No.
want for like an elderly compared to a baby?
no, I mean the same, whatever pressure it takes to stop that bleeding. Good question. This lady, or this time, they're using something called quick clot. So this is an example of that, which you can check out too. This isn't pregnant, we learned this out of military, we learned a lot in the military, unfortunately. But this has all over in it something called kaolin, and that helps the body make clots. So this is a nice tool to use when you're trying to control bleeding. Sometimes they're in some of our emergency kits and sometimes not. But if you have it around, it's a good tool.
So do like, let's say I go to Walmart or Sam's Club or something, and I wanna buy like a first aid kit.
Yeah.
Do any of those first aid kits have that type of?
Some do, some don't. So let's talk about that. Good segue. So I'm gonna leave you guys with this one for your class to have or do whatever you want with. And we're just gonna talk about what's in it. For those of you that learn by reading, there's some really nice instructions here. And I can just imagine in a terrible situation, you bring these out. And they're really small writing too. But that's in there if you want to read directions about it. So your tourniquet that you have, these blue ones are trainers. This orange color is the real one. So all of you guys should definitely practice with this kind of tourniquet, which we'll talk about in a little bit. You have a rolled gauze that is self-adherent, so you could, wrap it and get it to stick. You got a scissors, you have 2 gloves. You have a compressed gauze, so it's just like this one, except all squished together. You have a trauma bandage. Cool. So this one, it's this kind of one. I don't exactly know how to work it, just because I don't play much. But you would put this on your big wound, and you would, I think, like just wrap around, there's Velcro and stuff like that with it too. And then you just have a gauze sponge. So these kits roughly are $40. Sometimes what you can have is just the tourniquet part. Those should be at least $20. If you bother to go get any on like Amazon, don't get the ones cheaper than that because they won't do the work you need it to do. So at least spend $20 on that. I bought one of these, it's under the front seat of my car. This is similar to this one. And it's there. I hope I never have to use it, but I got it around. So you guys can have this one. I should have left it all like it was because you can never get it back in. But feel free to look at those if you'd like. Otherwise I do have this one you can check out too when you come up.